got a team. This is just an explanation of what to expect when we are doing our observations assessment. So I find the observation page and I will open up the assessment. Assessment observations. Click, tick. Now we are only going to be doing the observations part. We're not going to be doing personal cares or infection control at this time. So I've just made sure I've only got task 2A on here at present. Okay, so what will happen is you'll come into the classroom. You can practice as much as you want. And you need to understand what all the norms are and what is out of the norm. You need to get used to asking questions. You need to find a way of remembering if you're asking in pain in the pain scale, you need to go on and ask what type of pain, where's the pain, and how long you've had it. So there's a lot more to it than just taking the actual routine clinical tasks. So also, one of the other thing that you're going to be assessed on is how you have written and documented your observations. So on Moodle, there is also the NZNO on page 3 and 4 when you click it open of all the do's and don'ts. Now, do remember that is for the registered nurses, but we just want to aim for that level and aim for it, all right? But of course, we are healthcare professionals, not registered nurses. So here's some of the details that you will need to put on that documentation, okay? So let's have a look at that. Oh, this is all the infection control. We will not be assessing you on that tomorrow. This is to do with wellness, which we expect you to look at as well. So introducing yourselves, making sure you've got the right person, listening to the client, take time to listen to their needs and ask questions. Whatever you explain, you ask for consent that you can perform it. Remember the washing of your hands, that's first. So just all that genuine fluffy stuff, we call it, communication and fluffy stuff. Okay. What we are actually assessing you on here is that you demonstrate, so you're going to show us how you do certain clinical observations, and we want to make sure that you're doing the procedure correctly and you're doing the procedure safely. Now, even though it just says that there, we also want to make sure that you understand the normal ranges of all of the clinical observations. We will be picking 2 or 3 for you to do, but you still need to know the normal ranges of all of them. So what's the normal temperature range? What is the norms of a blood pressure range? What's the normal pulse? But also you'll have to ask the client, do they know their normal? Because it could be quite different. I hope this makes sense. The second part here is, have you written it and documented it correctly? Accurate demonstrates correct written recording of clinical observations, clear understanding of normal versus abnormal ranges. So if you did get an abnormal range, you want to start tailoring your questions to what you're asking. So if for some reason they had a really high pulse rate, asking them what they had for dinner possibly isn't really related. It'd be more things like, what have you done before coming here? How are you feeling right now? Do you feel that your pulse is rapid? Have you been smoking, drinking caffeine? All of that above. I hope that makes a little bit of sense. So that's all you're going to be practiced on. So just to recap, you'll be coming into class. You're more than welcome to practice a little scenario. You can have a cheat sheet or one piece of paper next to you, helping and prompting you for all these questions. We give you your assessment where your notes will be recorded on the assessment. The actual practice or the actual practical assessment will only take 10 to 12 minutes maximum. You don't really want to be going beyond that because you're then using a lot of time. Hope this helps.